Hi, welcome to Center of Balance Live. I'm Sinampua from Center of Balance, the acupuncturist. Okay, I have to do adjust the camera of my on Instagram. Okay, today's topic we're gonna talk about. Today's Thursday, so Thursday we're gonna talk about fertility treatment. As all you know that if you're following me on my video, you know one of our specialized treatment in Center of Balance. We've been doing it ever since the first year we started our clinic is fertility treatment. Okay, yes, we help female infertility and male infertility. Now today we're going to talk about charting basal body temperature. It's important when it comes to fertility treatment. Okay, when I say fertility, it's female fertility treatment. Okay, now you need to understand this. First, we know that when it comes to fertility, conceive, you want to have a baby, right? Now, you as female, you need to know when your ovulation. If you don't know when your ovulation, and you keep trying, and then nothing happened yet. So this is a very good moment, a good chance for you to understand why BBT, basal body temperature, BBT is so important. Okay. So basal body temperature charting is an important diagnostic tool in when it comes to fertility treatment. Okay, why do we need to do BBT? And as an acupuncturist and fertility acupuncturist, why do we want you to do BBT charting? It's because BBT can confirm ovulation. Without knowing when your ovulation, how do you know which way? Have you ever heard about the fertile windows? When is the fertile windows? You're gonna try, the fertile window is normally 3 to 5 days. And how do you find out fertile windows? From BBT. And you heard a lot about it, but you don't know how to find out. You're just guessing. That's not good enough, right? You want to be accurate. To look at the overall reproductive system health. So which means BBT could be able to tell the hormone, how your hormone present, how your hormone produce. Are they good or bad, or they're not enough, and you need some herbs to focus on which hormone. Okay. Let you see what BBT is. This, I hope you can see it. It's like this. Okay. Now I don't know whether you can see it clearly or not. So it comes in here and then up to here, right? So you can see two different phases. The temperature in here lower, and up to here higher. And this part is called follicular phase, and here is luteal phase. Okay, from here it jump up to here. And what hormone control here? What hormone control here? So we need to understand the temperature here is low, right? And this hormone we call cold hormone, and this we call warm hormone, right? So I'll let you know later. We're going to talk about that, and I want to let you know how you can take BBT. Okay, actually we send out to our patient, fertility patient, female patient, when it comes to fertility, we ask them to take the BBT, and we give them a list and teach them what should they do. Okay, and if you don't know what to do, we're happy to share. Okay, we're happy to share, and just give us an email. So as you can check our email on the top of Facebook, on description on YouTube, and then you can find our email, send us an email and ask us what is step by step of doing charting BBT, and I'll send you the free information that we have got in the paper. I will send it to you. Everything you need to know about charting BBT. Okay, basal body temperature. To record your BBT, okay, you will need to need a ovulation thermometer. Normally, we suggest you just get a digital thermometer. There are two ways to do it. One is oral, one is a vagina. And normally, I just ask my patient to do oral. It is more accurate when you do vagina. For those patients, if from oral and we see that it's not consistency and we can't see the pattern, then we might ask patient to do a vagina one. But normally oral be okay. So you want to get a new thermometer, digital thermometer. You don't want to just get an old one. So a new one with new battery, and it'll be more accurate. And you want to just use one for month and month and month. You don't want to use the old one that you bought a few years ago, or you use it for other people, and then you get it for yourself, and then after a few months you find, okay, it's not very accurate. Is it because of the low battery or whatever reason? So get a new one. It's not an expensive tool. It's just about $10 or $15. Quite cheap. You can get it from chemists. Okay. All right. So we're talking about where we're up to now. Okay. We talk about thermometer, and now we're gonna talk about how you're gonna you can, if you want to do it on a paper, you're gonna get a paper chart and you're gonna write down the temperature every morning. So if you don't want to do paper, if you cannot find a paper one online, send us an email. We'll send you. This is free. Okay, we're happy to help you. Now, if you we actually recommend that you use an app called Fertility Friends. Google Fertility Friends. It's free. You can download an app. It doesn't matter whether you're using what kind of cell phone. You can just go to the app store and type Fertility Friends app, and it's free. And they have a free video to teach you how to charting and how to understand all the charting and things like that. And you can put more things like whether you have cervical mucus or not, and when are you having intercourse, and do you get headaches, or what time do you get up, and if you feel unwell on that day, do you have period pain? When you start bleeding, is it spotting or emotional? Everything you can put it on the app. Of course, on the paper form you can mark down as well. So, but we do suggest just simply use Fertility Friends and put it on a cell phone. Okay, so when is the best time to record your BBT? Okay, it is important that you need to know that take your temperature immediately after you wake up every morning. Okay, each morning before you get out of bed or speak or drink. Okay, so before you get out of bed, as soon as you open your eyes, you put the thermometer under your tongue. Okay, if you put it under your tongue on your left side, you always put it on the left side every morning. Put it on the left side. You don't want to change today's right side, tomorrow left side. Always just put one side. It's more accurate. Okay. Try your best to take your temperature at the same time each morning. It's difficult when it comes to Sunday weekend. You might sleep a bit late. So and for those people who like nurses. I have a lot of patients, nurses, and they do shift work, and they sometimes sleep in the morning, sometimes sleep in the afternoon. And for those people, I just recommend them just do the basal body temperature in when they sleep at nighttime. Get out in the morning, because I try. There's no point when they sleep in the afternoon and get up at nighttime and go to evening and go to work, and the temperature just won't accurate. And one more thing is, when you have a fever, just stop taking the temperature. You don't have to record it, okay? If you're sick, okay? Use a consistent collection method. If you do orally, you always use orally. You don't want to use vaginally, okay? You just do one, okay? Not both together. If only the same side of your mouth, under the tongue, in the fleshy part where your tongue sits, okay? I just mentioned it already. So start a new BBD chart on the first day of your cycle, first day of full flow menstrual bleeding. Okay. So you start a new BBT chart, okay? The your day one is your bleeding, okay? If it's spotting, it doesn't count, okay? It's spotting a little bit, it doesn't count. The full blood, okay, that count day one, right? So basically, a few phases your fertility. About main phases, three phases, okay? One is four phases. I'm sorry, four phases. The first phases is in here. I don't know whether you can see it or not. Bleeding, menstruation phase. Okay. Then the second one is following about your cycle. A normal cycle is about 28 days, but I do have to tell you, not everyone gets 28 days, the perfect days. Okay, not everyone. Sometimes you want to get a consistency. If you're 32 days, and that's good, just 32 days, 31 days, 39, that's fine. Up and down about 3 to 5 days, and that's okay. Okay, not everyone is 28 days. Okay, so your period need to be about 4 to 5 days, and good period. I mean, good period with no PMS. PMS means you don't have pain or bloating or constipation or diarrhea or emotional or crying or moody, want to kill your husband, something like all this thing, uh, uh, grumpy, breast tenderness, or pain in the stomach or lower back. All this thing you're not allowed to have. Not you're not allowed to. When you have those things, they are abnormal. Okay, so you want to mark it down. Okay, so the period for follicular phase, okay, is in here, and then the temperature, it go up and down and down before it raise up to here, which is luteal phase. It drop a little bit and it raise up, but not everyone have the drop. Okay, not everyone have the drop, but if you can find a drop, this is definitely ovulation on that day. Okay, but sometimes it drop, like this is dropping, right? And here this is dropping, but it went up. It doesn't went up that high, so it went up just in here and it dropped again, and it went up, and this drop is actually ovulation. But most people will think, wow, this drop is ovulation. This is not. Okay, and when your ovulation, you have to have a look at it. You will have some signs like mucus. Okay, cervical mucus. It will become much thicker and stretchy. It look like egg white. It's not. It'll become creamy or watery first, and it get thicker and thicker and thicker, and it's move toward to ovulation date. And if you have a look on your, if the temperature drop, then you have egg white. That is the best time to try to conceive, to get try to intercourse on that day. Okay, So let's talk about follicular phase first, which is in here. So in your right after ovulate period bleeding, and that is follicular phase. Okay, during the first part of your menstrual cycle, the follicular phase, what hormone control? Estrogen. Okay, estrogen is a nominate hormone in woman bodies. Okay, this is the very important hormone, estrogen. Estrogens help you to produce your egg. Okay, and it's a co-hormone. Co-hormone, meaning your core body temperature is slightly colder during this phase. Okay, and also in this phase is and the lining is actually built up the lining. Okay, it built up the lining. The lining get thicker and thicker and thicker and thicker. Okay. Then when it comes to the other phases, we call it ovulation phase. Okay, so in here follicular phase, ovulation phase. Okay, and ovulation phase is as you approach to ovulation, your cervical mucus. We talk about cervical mucus. It'll increase. Okay, due to why it increase? It's due to because of the estrogens increase as well, and it become more obvious, and you feel more wet. Female, you feel more wet and cold, and clear and stretchy. Again, it become egg white and very stretchy. And the 3 to 5 day prior to ovulation is normally that's what we call fertile windows or ovulation phase. Okay, about 3 to 5 days. 3 to 5 days. Right before ovulation, you might also notice a slight drop in your BBT. That's what we talked or just mentioned about it. Slight drop. Okay, when a slight drop, you can see the slight drop. It's definitely ovulation. And before here, 3 to 5 days before that day, that is the best time for conceive. So the next phase is so we talk about bleeding, follicular phase, and a little bit of ovulation phase. So it's about fertile windows of 3 to 5 days. That's ovulation. Then so this is ovulation, right? So 3 to 5 days before that, that is day 17. If we say that, that's day 17. So from day 12 to day 17 is the best time. It's the best time. And after day 17, if you keep trying, there is no, it doesn't work after that. Okay, it doesn't work after. So if you think about it, if you are not tracking your BBT and you keep thinking that you have your ovulation over here, closer to here, because what happened is if you just rely on your cervical mucus, egg white, and what happened is egg white can happen anyway between here and here. It can happen in here. So if you happen to we have a egg white, then as well as the temperature drop, then you're more accurate to a high chance to get pregnant. Okay, so this is important. So when you ovulate, an increase in progesterone, so from the hormone from estrogen become progesterone. Progesterone is what we call warm hormone. It triggers a slight increase in your temperature. So you see, from here, low temperature, and up to here. You see what I mean? So this is progesterone control. It's warm hormone. That's why the temperature went up. Okay, temperature went up. Then what happened now is this is called luteal phase. Okay, luteal phase. Then what happened in here is the lining keep going. Okay, and this is the best time for implantation. If the eggs and sperm meet together, it become embryo, and this is the best time to implant properly. What I have to tell you right now. So the increase of the temperature normally approximately 0.2 to 0.4, and there's a saying that from here that it can jump 0.3, between 0.3 to 0.5. There's very good ovulation, perfect ovulation, which means the eggs released, you want the projection strong enough as well. If the eggs release and the projection doesn't follow, it doesn't raise the temperature, which means the weak of projection. And if you're lucky, you're pregnant, and that is easy, very easy to cause miscarriage. Okay, so in this phase, we really want to see that when it's up, you want to hold it for whether your progesterone is good enough, strong enough, the strength strong enough or not. They become two things. So in this phase, it needs to be raised up the temperature and continuing in here for at least 11 days before it drop to get into the next cycle. If you have a short luteal phase, there's something that we need to use herbs to increase the luteal phase. We call yang deficiency. Okay, so we need to use some herbs to increase it. If it's too short, there is weak luteal phase, and a lot of people have this. A lot of women have this problem because they can't get pregnant because of low luteal phase. Okay, progesterone. A lot of people use cream. I don't recommend you use cream. We have the reason because cream is something that's from the outside, external things. If you're pregnant, yes, you get some cream that prevent miscarriage. But if you know you charge your BBT, you know that you have short luteal phase, we use Chinese herb to boost it up. Okay, make it last longer, make the temperature stay up. If it's too low, if you can't see two phases, it's just go like this, then we need to put it up and go two phases. So the more important here is not about how high the temperature is or how low the temperature is and here and here. It's about here and here. You want to see two phases rather than just one phase. Okay, you want to see the temperature change after ovulation, and this is the most important thing that we look at when it comes to talk about luteal phase. If the follicular phase is too high, we will call this is indeficiency, too much heat in the body. So we need to reduce the heat. When we use the heat, the phase will go down. So, and you see on the hormone, there is cold hormone, estrogen is progesterone, there's warm hormone, right? In Chinese herbs, we have warm herbs and cold herbs. Cold herbs try to clear the heat. Warm herbs try to warm your body up. So if you feel cold all the time, you have cold hands and your periods delayed, most likely you have low progesterone. Okay, but really, we have to diagnose it properly. BBT is the way to go. Charting BBT is the way to go. Okay. So that's it. So important thing that's in here, I do have to mention right in here. You don't compare your BBT with other people, your friends, because everyone's cycle is different. Your body temperature is very different. You need to compare your BBT with your one. Like this month compared to last month compared to the month before. Okay, you never compare your BBT to other people, because everyone is different, and the normal is there is a huge range of normal. Okay, a very huge range of normal. So every woman's cycle is totally different. Okay, you have to keep in mind. You can't just go to your friend and look at your friend's BBT and they say, "Oh, you're better." Don't do that. This is a big mistake. Okay, so yeah, so we specialize in Chinese medicine and acupuncture for fertility treatment. Okay, in a reproductive area, we've been doing it for the last 13 years. Okay, so we're quite experienced in this part, and we successfully get helping a woman to get pregnant, to successfully get their baby. Even they are going through for IVF, and we have acupuncture to support the IVF, before IVF and after IVF. Yes, if you want to get uh, uh, some help, in fertility treatment, we recommend it 3 months at least to get your body balanced. But do you need a treatment? That's important. That's a question. So come in for initial examination. You have to fill in a complete form, ask you all about your health history. Then we're gonna sit down for half an hour to 45 or even an hour to go through everything and to ask you further and your pulse, see your tongue, and for you to understand everything and what is Chinese medicine and acupuncture can offer you, and to make a plan for you for your lifestyle changing as well, to advise you what you can eat, what you can't eat. Coffee, tea, caffeine. You have to give up those, and alcohol you have to give us, and smoking you have to give us those. Okay, to be able to get a pregnant, beautiful pregnancy journey. And I always tell my patient, pregnant is just a start, because you want to get your body healthy, because you want to get a healthy baby, right? In the end of the day, you want a healthy baby. So with a healthy baby, you want a healthy body first. Healthy body, mom and dad, healthy baby, and what else? When the time that when you deliver your baby, it's just a start of a family. Start of a family. You need to take care of your baby. You need to have your energy. Okay, if your health is in crap, you're lucky you get pregnant, but when you have your baby, it's a lot of work to take care of a baby. So you do need to understand that, okay? Because people so exciting that they have a baby, they get pregnant, but they don't know this is just beginning, the harder part. A lot of people find it very difficult to get pregnant, but actually the harder part is when you get pregnant and when you due to have a baby, your baby birth, then you have a lot more thing to do, right? You have a lot of things that you have to give up for the baby, you know. So you really need to think about it, and you want to get a healthy baby, come to acupuncture. So our phone number is 078467956, 078467956, right? This is for tonight, and you have a good day and have a good night. Stay awesome, and I love you all. See you. Bye bye. How do I end this one? Here you go.